So glad that you're all here at our very important meeting on a subject. Oh, I'm Cara Robin. By the way, for those of you who might not know me, I'm president of the West LA Democratic Club, our club here. Thank you, everybody. Anyway, we're all here because something is on our minds, right? And we know who else's mind it's on, yeah? Speaker John Boehner. Can you believe it? I mean, can you believe tying our budget to defunding Obamacare? I mean, who are these people? Who are these people? I don't get it. I don't get it. Anyway, it's all a charade, as we know. It's all Tea Party games, right? They're going to pass it. Okay, we're defunding Obamacare. It'll go to the Senate. They'll say, yeah, right, we're not defunding Obamacare. It'll go back to the House, blah, 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 wasting everybody's time just to have some Tea Party sandbag or whatever, sandbox games, until we finally get, you know, a workable budget passed. But aren't you tired of this? I'm really tired of this. And you know what it tells us, though? 2014, don't let us lose the Senate. Don't let us lose the Senate. We're not going to get the House back yet, but don't let us use the Senate. We're going to be calling on you to, you know, make some phone calls, give some money, da-da-da. You know the drill, but that's why we're here. That's why you're all here, right? We're all here together because we want to keep our country. We want to keep it as good a country as we can. And we're on a start now. This Obamacare is a great start for us. Anyway, that's my little rant. I want to thank all of you who have joined or renewed your, what? What's happening? Farther away? Thank you. I want to thank all of you who have joined or renewed your, okay. All right.
It's not on yet. It's not.
Dress rehearsal.
Try that one. Yeah.
It's not, the light isn't on.
Oh, this doesn't have a light. It should be on.
Hello? Hello? Testing. Okay. So I want to thank all of you who have joined or renewed, paid your dues for 2013. We do the best we can to educate you all. You know, we do some really good programs. We had that amazing forum with all the LA City candidates from the mayor on down to the school boards. I mean, it was really spectacular. We had Congressman Henry Waxman here. You know, we had our Gasland 2 film showing that amazing education forum last month. And now we've got David Lazarus on our Obamacare. We want to do this. We want to keep doing programs for you. And we need your support. We need you to join our club. If you haven't, all kinds of ways to join. Tracy's back there. Yeah. Anyway, we do really want you to join. And we used to have our bylaws read that no matter when you joined during the year, you had to renew at our February meeting, which is our annual election meeting, our general meeting in February of whatever year. So even if you joined in August, you still had to renew in February. We are going to have at our next meeting a vote from those of you who are members for 30 days. Right now, we are going to have a bylaws change saying that your dues will now be good for 1 year from the month that you join. So if you joined in August, you're good until a year from August, right? Till August 2014. Just letting you know that's going to be coming up. Okay. So, I have something really exciting, another great event for us. I want you to mark your calendars, maybe not now, but in your heads, okay? November 6th, a Wednesday night, we are having a First 100 Days Forum with Mayor Eric Garcetti, Controller Ron Galprin, City Attorney Mike Fuhr, and our council member Mike Bonin. It's going to be amazing, and it's going to be a forum saying, what have you done to date? What about those campaign promises? What are they looking like? Where are you going? It's going to be moderated by Warren Alney. Yep, and it's taking place in the big hall at LMU. And we're putting this on with our sister club, the Westchester Playa Democratic Club. We're real busy now. We have our little steering committee working on the questions and what we want done. So just giving you a heads up that November 6th is going to be a terrific program. I would generally save the announcements and all till the end, but I think there's going to be a lot of questions, so I'd rather do it now and then we can let David take over. Okay, there's lots of things on your seats, lots of literature. One thing, my assembly member, Steve Bradford, is having an Affordable Care Act Town Hall meeting on October 12th, Inglewood City Hall. Okay, you all have that, so you'll learn a ton of stuff tonight. You can take it forward on October 12th, get to know there. One of our member at large, Nadia Lawrence, where is Nadia Lawrence? There she is. Nadia is really responsible for getting this whole meeting together, and Nadia belongs to the Los Angeles Recorder Orchestra, and they are having a concert, yes, right here on this Sunday. So if you can all make it, and again, it's on your seats. If you can't make it then, there's one the following Sunday at St. Andrew's Episcopal Church, okay? Then we've got things from nurses. You can read all of this. Healthcare facts, single-payer healthcare. I've got my sisters in sin here. Where's Maureen? Maureen Cruz and Susan Haskell. We've been working on this single-payer, trying to get single-payer for God knows how many years. Y'all know I'm a die-hard single-payer person. It will happen. Obamacare is the beginning. It's going to happen in California, and it's going to happen in our lifetimes. Guaranteed, right? Okay, we also have coming up at AMVETS, remember those of you who are at our film, the Gasland Part 2 film, we held it at AMVETS in Culver City, and these are our artists, our veterans who are actors, directors, producers, and they do these great shows. And this again is on your seat. It's called Tracers. They've been really supportive to us, these people at AMVETS, so let's go out and support them. Joy. Great. So let's go out and support them, okay? And I think that's about it, except we have printed out a glossary for you on your seats that'll give you kind of heads up on what these terms mean that are being used. We've got a covered California fact sheet. Do you have it? Do you all have it? The covered California fact sheet. Their website is really, really extensive. It's coveredca. It's on here. .com. Coveredca.com. Go on that website. Everything you want to know is there. Tons of links. We just gave you a little outline of what's going on. And now our speaker this evening, as you all know, because you're here, is David Lazarus, who is an award-winning columnist for the Los Angeles Times, also a reporter for KTLA's Consumer Confidential segments. He is an advocate for the little guy, right? And his work's resulted in laws protecting Californians, including new safeguards for voter information, which is really important for us. We will actually be having a meeting on voter information coming up early next year. His columns on healthcare have resulted in hearings in Washington and Sacramento and have been praised by lawmakers for shedding light on business activities that put consumers at a disadvantage. David has also earned 2 National Headliner Awards and multiple honors from the Society of Professional Journalists. He received a Golden Mike for TV commentary and was named Journalist of the Year by the Consumer Federation of California. But Laz, as he likes to be known, likes to say that the real prize is helping ordinary people deal with problems when no one else is able to step up. His talks on health matters are highly praised, and we are honored to have him as our guest tonight. I'm going to leave you now. Okay, it's all his. Take my little pen.
And good night, everybody.
feel a little out of place here. It's like, and now the Jew will lead you in, or rather, our sermon tonight is on the stigmata counts as a pre-existing condition, and Jesus couldn't be covered in the individual market if he wanted to, and John Boehner doesn't give a shit. Sorry, God. Sorry about that. I don't know how much I'm going to need this, because projection really isn't one of my issues, but I'll hold it for a bit. As we heard from there, the Republicans in the House will be voting tomorrow on defunding Obamacare or bringing the government to its knees. Now, if the definition of insanity is doing the same thing over and over and expecting a different result, these people have already had 40 votes to bring down or cripple Obamacare to no avail, and here they are again, walking down the same road, and yet now it's not just about playing to the cheap seats in the Tea Party. Now it is about putting the American economy on the line. Now is it about putting the full faith and credit of the American financial system on the line. Now it's about holding us all hostage until they can get what they want. What do they want? They want to deny health insurance to the 50 million people in this country who do not have it. Let's underline that for a moment. 50 million people who do not have health insurance in the richest, most powerful country in the history of mankind. A shameful state of affairs, an unconscionable state of affairs. And Obamacare gets us partway there. Under Obamacare, we maybe bring 20 to 30 million people into the tent, which still leaves tens of millions out in the cold. In other words, nowhere close to universal coverage. But you can't say universal coverage these days because that's code for socialism. And socialism, of course, will be the ruin of us all. So we can't go down that road. Now, this is truly nuts. And what I don't understand is how the Republican leadership passes this along to their rank and file voters as being in their interest. Now, the interests of big business, I get that. The interests of Anthem Blue Cross, I get that. The interests of Health Net, I get that. But some farm couple in Nebraska or Iowa or some other red state bastion is sitting around thinking, well, John Boehner says this is going to ruin us, so I guess it's going to ruin us. What's going to ruin us are low-income people who either can't afford or have been denied because of pre-existing condition health coverage, going to the emergency room, getting the most expensive treatment on the planet, passing those costs along to taxpayers, passing those costs along to those who do have insurance, their insurers in turn jacking up rates for all existing ratepayers. How screwed up is that system? It's just, I mean, my kid's 12 years old, and even he, when I go on like this at home, and I do, I mean, just, sorry, son, even he looks at me and says, well, why is that? I mean, that makes no sense. This is a 12-year-old talking now. That makes no sense. And I have no answer for that. Because our entire system is predicated on a healthcare delivery system that makes no sense. For example, employer-based coverage, which is probably one of the stupidest things we've ever done. Now, it's a historical accident, as many of you know. In World War II, there was a cap on wages, and there were limits on what companies could do to get people into the company, so they started offering health care as a benefit to get workers in. Made sense at the time, you know, Rosie the Riveter, you know, it was that kind of time, and then we stuck it out. And employers remained the primary conduit for health insurance in the United States. There is no other developed country in the world that does this. For good reason. Because it's wildly inefficient and wildly expensive. Moreover, gross obviously favors the employers because you become a prisoner of your employment. I'm a type 1 diabetic. I'm wearing an insulin pump. I am uninsurable, like Jesus. We're like that, dude. I'm uninsurable in the individual insurance market. I can't leave my employer. Now, think of the power my employer is able to exercise over me as a result of that. That's not what Jimmy Hoffa had in mind, I'll tell you that much. Now, this is a crazy system because even if you are not a prisoner of your health plan, you do not have portable insurance, which is nuts because you can't job hop. You can't go where the action is. You can't take your family out of an economically depressed area and move them to an economically advantageous area where a job might be because the health insurance might not be as good. This is no way to deliver health insurance. Moreover, we're parceling up the risk pool. And I'm not going to get all wonky on you. I'll leave that to Michael Hilton. Love you, Mike. But the risk pool is everything. When Republicans talk about socialism in healthcare, these are guys who skipped school the day risk management was taught in Econ 101. Because insurance is not alchemy. It's not how you turn straw into gold. Insurance is the art of managing risk. It's really that simple. And as such, if you are going to manage risk, the trick is to spread that risk as far and wide as you can, and thus have the entire body politic sharing the risk, sharing the wealth, sharing the benefits. And when it comes to health insurance, as with car insurance, for every crappy driver out there, you want a really good driver, balancing that person out. That's how it works. And in the grand scheme of things, hopefully you've got more good drivers than crappy drivers, and the system is able to keep self-sustaining. Health insurance is the same. For every sick person, like me and Jesus here, hopefully there will be a bunch of young and healthy people on the other side of that equation balancing it out. We've got a system that's rigged against us. It's called cherry picking. The insurance companies basically took one look around and realized, well, wait a minute. If we insure sick people, that's bad for business. And you can't blame them. They are businesses after all. They are all about the bottom line. They are all about making shareholders happy. I get it. It's capitalism. But if that's your business, well, anytime someone submits a claim, that's a liability. Bad thing from a corporate point of view. Anytime somebody pays a premium, it's an asset. It's a good thing. So what do you want to do? You want to jack up premiums as much as you can, get healthy people into the fold who aren't going to make claims, and keep out all those sick people. Well, of course, these are the very people who require health care. So you've now doomed the system because all of those people end up forming a risk pool, a really expensive risk pool. And in that risk pool, they can't afford coverage because the premiums are too high. Why? Because it's nothing but sick people. I mean, this is big math now. Again, I think the Republicans skipped school that day when this was taught. Because we're not talking now about socialism. We're not talking about communism. We're not talking about kibbutzes. We're not talking about anything that smacks of everything these guys are against. What we're talking about is exactly what these guys understand, and that is personal responsibility. Ding, that's one of their ideas. We're talking about management of our resources in the most efficient way, and they're conservatives. Remember? That's what they're all about. By definition, they're conservatives. They're all about conserving resources. Now, granted, that's not natural resources. Granted, that's not us. But there are corporate resources at stake here. My God, we're going to defend them. It's frustrating. It is. And what makes it all the more frustrating is that the fixes are there. It looked like Obamacare was going to do it for a while. Obama put the public option on the table. And that was That put the fear of this guy into the insurance industry, because the public option basically was going to be the first step towards, all you guys like, the single payer system, that holy grail that has been so elusive to Americans. And anyone who's not familiar with that, single payer, basically Medicare for everyone. That's kind of what we're talking about. We've already got a single payer system in place, Medicaid. But of course, we have constructed it in such a way that it is doomed to failure. Why? Because the people in Medicare are over 65 years old or disabled. These are sick people. These are expensive people we're talking about now. So that's going to be a very expensive system, right from the very conception. You've now taken some of your most expensive insurance risks, put them all together and said, boom, you've got insurance. Okay, that's not how you do it. Medicare for all means all the college students at UCLA who are going to live forever, who can do everything to their bodies and bounce back the next day, they'd be in the pool too. And they'd be balancing out everybody else. And so when you talk about Medicare for all, you are talking about the single payer system that we've all talked about for so long. It's not an act of immaculate conception to bring that about, because we've already got it. Moreover, here's a dirty little secret that the Republicans will never want you to know, but here it is. Between Medicare, Medicaid, veterans assistance, government accounts for 60% of healthcare spending in the United States. Think about that. All those people who say, oh my God, the public option is going to bring us down. It's the road to ruin. Next stop, Havana. The public sector already accounts for more than half of the $3 trillion that we spend every year on healthcare in this country. And my colleague Chad Terhune reported yesterday, that in the next decade we can expect annual healthcare spending in the United States to reach $5 trillion, roughly 20% of the economy. Crazy numbers, simply crazy numbers, unsustainable numbers. And this on top of what we already know. And that is, according to the OECD, the Organization of Economic Cooperation and Development, the United States spends more per person on health care than any other developed country in the world. Britain, Sweden, Finland, Japan, Australia, our buddies in the developed country club where they hang out. We spend twice per person what these other countries are spending. And so, when you hear a figure like that, you go, well, at least we have the world's best healthcare system, as the Republicans are fond of telling us. Well, no, because we have shorter life expectancies than people in those countries. We have higher infant mortality rates than people in those countries. And those are two key yardsticks of the efficacy of a healthcare system. Therefore, again, my 12-year-old kid could figure this one out. We're not getting a lot of bang for our buck. We're spending twice per person as the other guys and getting less health care as measured by demonstrable results in these other countries. Now, if I was pulling this stuff out of a hat, we'd all go, oh, that's disputable. None of this is disputable. None of this is on the table for debate. This is reality. And yet, we don't have a conversation about these salient facts that clearly point to a healthcare system that is failing this country. Instead, we talk about the market. Free market. Market is going to look after us. The market will take care of us. But look what a great job it did for Wall Street. Well, healthcare is no different than that. I mean, healthcare is not a commodity that you can offer like sneakers. Sneakers you can sell and they can compete with one another, and the consumer can come into the Nike store and check them out and make informed decisions about whether to have Air Jordans or not, or this or that. We're making good decisions as consumers. Healthcare is not that product, and for very good reason. We're in no position to make these decisions. You go to the doctor and you say, I got this thing, the pain right here. think I want an MRI. Well, who are you to say I think I want an MRI? Doctor, you're going to sit around and you're going to wait for the doctor to say, all right, my friend. Now, you can't shop around at that point. The doctor has said you want an MRI, so who's going to say, I don't know about that? Not a lot of us, to be honest. Moreover, how much does an MRI cost? Who knows? Who knows?
Anywhere from 300 to 6,000.
My God, you mean my dollar. I like that. An MRI costs anywhere from it's about 306,000 bucks. Not that long ago, I got bit by my swine cat. It's a 20-pound cat. He's a big animal. And he bit me. And it turned, who knew the cat bites are basically like that? I didn't know. All right, so the cat bite turns into an infection. The infection gets bad, and the antibiotics are not doing the trick because of my diabetes, and before you know it, I'm looking at surgery. And a week in the hospital. Damn cat. I had to get an MRI for the cat bite. That MRI cost over $4,000. As soon as I got out of the hospital, I went onto Google and looked around. There are clinics right around here that offer it for $300. Now, if I'm a smart consumer, I'm able to go out and get the best possible deal, as I do. It's not like I go out to Whole Foods and do my shopping. No, I'm smart. I go to TJ's. And if it's not good at TJ's, I go to Ralph's. And if it's not good there, I'm smart and final. I know how to shop. But when the doctor at the hospital says, you need an MRI, I say, okay. Because his next words were, I think we can save your hand. I'm not shopping around at this point. I'm saying, save my hand. Do what you gotta do. Now, as a consumer, you're in no way in the driver's seat here. You don't know what you need. You don't know how much it costs. You don't know who offers a better product. It's a complete relationship of trust with the guy or the woman in the white coat who is telling you that you need these things. Imagine if you went to Toys R Us and the salesperson says, you need this, this, and this. No choice. Well, that's not how I shop. That's exactly how you shop when you go to the hospital. This is crazy. There's a thing at the hospital called the Charge Master. Did anyone see that wonderful article by Stephen Brill, Time Magazine? Great. Yeah, it's great. I want to option the movie rights for that thing. It was a great article. What? Projection is really not my problem in life, but okay, all right, my bad, I'm sorry. Whenever I'm on the radio, the engineers are always turning the dials down. I start shouting into the microphone. I always see them in the control booth quickly turning the knobs down as fast as they can. All right, I'll be louder here. Well, the Charge Master is basically a fairy tale. It's a work of fiction. The hospital sits down one day, breaks out a keg of beer, and says, what are we going to charge for this? Let's invent some really crazy number, put it here, and then when the insurance company says, I don't know about that, we'll negotiate. Really? And this is kind of like how car dealers work, except we're on to them, so they can't jack it up too much because once the haggling starts, if they're charging $10,000 more than you're out of here. But that's how the Charge Master works. It's pure fiction. And the entire conversation related to your bill begins with an act of fiction. The entire conversation, everything that will follow financially based on your medical experience has now been predicated on basically Snow White and the Seven Dwarfs. That's no way to run a railroad. That's crazy stuff. Again. And then the insurers, God love them. Researchers at Harvard estimate that we squander up to 50% of our healthcare dollars on bureaucratic overhead. Now, remember, I said we spend $3 trillion a year in this country. That's $1.5 trillion potentially on paperwork. Not on health care, not on Getting my cat out of my life? No, paperwork. Why? Because the insurers do not have a standardized system. Every single one of them has their own system. And they're labyrinthine, they're difficult, they're obstacle courses. Therefore, doctors require vast staffs of people who are fluent in multiple languages. They have to speak HealthNet. They have to speak WellPoint. They have to speak Kaiser. They have to know this stuff. And this takes time. This is difficult. And we squander so much money on this unnecessary thing. And it's not that I'm against insurers because, all right, I'm totally against insurers. I can't think of a good reason. I just can't think of a good reason why they are involved in the delivery of health care. Because there is nothing about this product that is conducive to the profit motive. This is not like any other widget in the marketplace. This is a product that well, quite literally, lives are on the line. And you've got this industry cutting themselves in for a piece of the action, like the Corleone family. And what do they bring to the table? Do they bring us lower prices? No, that's something that we could do ourselves or through a single payer system, have a single entity doing on our behalf. Do they bring order to the chaos? No, because it's just as chaotic with them as it would be without them because of all their competing systems. What do they bring? Well, they do bring obfuscation, yes. Thank you. But what they also bring is an open hand, saying, give us money because. And we perpetuate this system on the mistaken belief that the private sector has somehow proven itself adept at the delivery of this product. And now let's go right back to where this conversation began. 50 million people uninsured. Is there anybody who can tell me that the private sector in any way has succeeded at the mission that they have set out upon? In other countries, they have universal coverage. I'm sorry? Well, okay. Now, in other countries where they have universal coverage, there is a role for the private sector. They aren't cut out of the equation. But they have hybrid systems whereby the state forms basically the base, guarantees a certain humane level of coverage to all, and the private sector steps up on top of that and orders supplemental coverage. It's exactly how it should work. That is capitalism in action. Filling a need, the better mousetrap theory. But without that state base underneath, well, then otherwise you have nothing but predators out there trying to gouge the public, which is what corporations do. That's their thing. There was a study not that long ago showing that if you looked at the psychological behavior of the average corporation, according to the DSM-5, your average corporation is psychotic. Just simply looking at their completely self-interested, sociopathic behavior in which they have no moral compass whatsoever because they're all about the bottom line.